Let's look at those freedoms that are on the way from New South Wales. The reopening plan unveiled yesterday. Live now to Gabriella Power. Gabriella, business owners still want to know how they're expected to enforce the rules.
That's right, Laura. Under the Berejiklian Government three-step reopening plan, by October 11, we'll be able to have 5 people over to our homes. Pubs, cafes, restaurants will be able to reopen. By around October 25, when we hit 80% double dose, that number increases. We'll be able to have 10 people over to our homes. We'll be able to stand up while drinking at the pub, have an unlimited number of people attend weddings and funerals, as long as you are fully vaccinated. So residents who want to take part in this will have to show proof of their vaccine status, either through a vaccine passport or a vaccine certificate. But come December 1, as you mentioned, that all changes and it becomes a free-for-all, and unvaccinated residents can take part in these activities. So businesses right now want clarity about how they're going to navigate this. Some are scrambling already to get legal advice, fearing that there may be lawsuits if someone was to get sick inside their venues. And the CEO of Just Cuts has told Sky News that businesses really need more clarity.
At the end of the day, our hairdressers are hairdressers. They want to cut people's hair, make people feel good about themselves. They really don't want to be a bouncer at the front door saying, you know, who can and can't come in. There are, you know, people that may not be able to be vaccinated for medical purposes. And we're seeing that with mask wearing at the moment. Some people don't have a medical exemption for masks. How do you manage that if they don't have the medical exemption on them?
We've got 500 staff that work for us. You know, look, at the moment, probably there's 200 unvaxxed, but they are considering. We know that they are considering it, but as an owner, I can't force them in what to do. Honestly, only the government or the health order can, or if not, we're going to have to wait till the 1st of December.
Yeah, it's really tough for businesses to navigate this, but one of the good bits of data that we've seen in the last couple of days, Gabriella, is new data suggesting that hospital and ICU admissions are well below what doomsday modelling had forecast for New South Wales.
That's right, Laura. The high vaccine rate that we have in New South Wales is already having a big impact on our case numbers and hospital numbers. So the modelling had predicted that cases would surge, or hospital numbers would surge rather, in October. But we'll bring up this graphic to show you what's actually been happening, and the numbers have been dropping. So just a week ago, there were 1,286 people in hospital with COVID-19. Right now, there are 1,155. So it has dropped. And in terms of those people requiring intensive care, last week it was 244. Right now it's 214. So modelling by the Burnout Institute is proving to be wrong, which is of course good news. And just last month they predicted that there would be 560 COVID patients requiring ICU care. So that's double what we have at the moment, and it doesn't look like that is what's going to happen if the trends continue. Let's hope that that is what happens. And in terms of the impact it has on case numbers, they are dropping. 787 infections recorded yesterday, Laura.
Okay, we will wait to see those numbers today at 11 a.m. Gab, thanks so much.